Acute and chronic infections can be so disruptive to our lives, and really where we have to, put things on hold, we feel horrible, or just impact our lives long term. So, if we're thinking about whether it's shingles or, a bad cold, a bad flu, we're thinking about chronic mono, we're thinking about Lyme, or we're thinking about our chronic gut infections or our acute gut infections. Like, what is one therapy that can help all of these things in an amazing way that you likely haven't thought about? And that would be ozone therapy. So ozone therapy is one of my favorite therapies for treating infections, whether they're chronic or acute, and just generally supporting the immune system and really pushing people in their healing. So let's talk about it. So what is ozone therapy? So ozone is the O3 molecule. We breathe oxygen, which is the O2 molecule. When ozone is made, and so when we are using that O3 molecule in the body, it does a lot of amazing things. It's what I would call, one of our highest levels of regenerative therapies, right, and healing therapies. So let's talk about how it works in the body. So whenever we introduce it into the body, now this can be in a very specific area. We will use it sometimes in joints. You can put it into the colon if we're thinking about the gut. But most often for our acute and chronic infections, I'm talking about using it systemically, so all throughout the body. And I'll talk about how we do that. So when we put it into the body, it is significantly anti-inflammatory. So again, whether you're experiencing, an acute infection of a flu, or you're, chronically ill with something like Lyme, the body tends to ache, right? It's one of our natural responses in trying to kill off a pathogen. And what people will notice when we initiate the ozone therapy, that really the whole body just feels calm down. They feel like, oh my gosh, like I was feeling so inflamed, and now I'm feeling so much better everywhere in my body. When we look at detoxification, it really helps the cells to heal and create energy, which helps them to move the toxins and the things they're being exposed to out of their area, to be able to also for your white cells to kill pathogens. So if we think about like why this is important in infections, there is a lot of toxin overload from the virus or bacteria or parasite that is in the body, right? There is a lot of toxin release when they are killed and when they're replicating. And so ozone is going to help your body and your cells be able to manage that and effectively push those things out of your system. Because with infections we also have damage, we're going to see healing of the tissues that are being impacted. So say for instance, if it is like a diverticulitis, right, which is where an area of the colon has, usually it's typically bacterial, there's a lot of inflammation in that area, and just, like the tissue is not happy, it's red, it's inflamed, and we will see healing, of all those layers of that tissue. So the other pretty neat thing that I really like is that it's really going to push our own internal production of our antioxidants. It's very good at this. So it really pushes the cells. So we get a big release of glutathione and a bunch of the other list of antioxidants that work to heal on on a cellular level and just throughout every single area and every single tissue. And then when we're thinking about, whether it's acute or whether it's chronic, when we're dealing with a pathogen, what we see when we're using ozone is we get a significant reduction of the load of that virus, and that's important if we're thinking about things where, we might think about, viral load in some of our chronic infections, whether that's Epstein-Barr, if we're thinking about long COVID, right, they've seen that it's still existing in the tissues. If we're thinking about, acute infections, you're going to find that virus in specific areas like shingles. So we really get a significant reduction of viral toxicity. So let's talk about some acute infections where this can be helpful. Shingles. So shingles is an outbreak if you've had chickenpox you can later get shingles, which is basically a herpes outbreak along a dermatome of the body. So most people, a lot of times it's on the trunk of the body, and what they'll have is a very painful rash and a strip on one side of their body, say like across their chest, and it hurts so badly. So I've had people come in right when those little lesions have popped out, and we've done one systemic treatment. And it's not just me, other colleagues that I have, and there's other doctors that have, put this out there, written up case studies, where it has literally the next day been gone, right? Essentially those little lesions have healed up. I had someone come in, she was already immediately started on the antiviral. She had a strip across her eye in this whole area, which is extremely dangerous for blindness, right? That having the shingles virus or outbreak around your eyes is horrible. I mean, the risk for blindness is high. And so she was like, let's just do everything. So she started the antiviral protocol, the medication, and we did one ozone. And the next day, this was basically gone. You couldn't even see it. It was little pinpoints. There were no weeping lesions. There was nothing there. Absolutely incredible. So, if put this in your back pocket, obviously you probably, you might not be watching this video when you've, had shingles outbreak today, but if you have, come in, but keep it in your mind for the future if it does pop up. So let's talk a little bit about chronic acute gut infections. I've had people with diverticulitis, which is an infection of a pocket in the colon, where they've been on multiple antibiotics. So they're doing all the standard therapy, right? They've done IV antibiotics, they've done the oral antibiotics, they've done multiple regimens, and their doctors now are going, we might be at the place where we need to think about resecting that part of the colon, which is huge if you're, to lose a part of your colon. And so we're like, okay, hey, you know what? Let's just give this a shot, and had incredible results at knocking out that infection. It's like, so again, one thing I just want to note, if you've tried, often we want to incorporate the standard therapies, when we're dealing with many of these things. Am I going to put you, if you have shingles, on the standard antiviral protocol, if you have an outbreak? Yes, we are going to do that too, but we're also going to do ozone, right? And because the treatment, your ability to heal is just going to be so much better. So now I wanted to talk a little bit about Ebola. Not that you have risk of Ebola here in the U.S., but I just wanted to describe this study that was done, because just to show you the power of ozone on infections. So there were a group of MDs that went to Africa, and they were given permission to take ozone therapy. And what they did there in Africa for Ebola is they did it's called direct ozone. We don't do that here in the US, but it's another way to get ozone into the body without having to have IV bags. So it's directly infused into the vein. It actually can be done, believe it or not, very safely. It's just, again, for liability reasons, it's not something we do here in the US. They had an 88% cure rate of Ebola of the people that they treated, which was absolutely incredible. And you can find this. This was Dr. Robert Rowan had spearheaded this with a group of other doctors, and it was so good. It's interesting, you can hear him talk about this, that essentially the president had him come in, treat his staff, his family, and then said, get out. It's too effective, basically, because that country receives like billions of dollars for Ebola research, which they should. So it's a very interesting political thing, but think about, again, you can find Dr. Rowan online talking about this, like the power of the ozone to be able to eliminate that virus. I'm going to share another case study that I thought was so fascinating. So one of my colleagues who works with a team on the East Coast of MDs they had a young gentleman who had his foot cut. He ignored it. It became gangrenous, and basically started eating the flesh all the way up and around his foot. And so they did IV antibiotics. They did everything, and essentially it just kept traveling. So they're like, the only thing we have left is a below-the-knee amputation. And so his family, I think he was like 26 years old, looked for options, and they found a regenerative medicine group and got him in, and they did ozone systemically every day. They also wrapped the limb and pumped ozone around it, which will push healing of those, because it was a big wound, right? Within the month, it had completely sealed over and the infection was gone. And this, again, a young man who was looking at losing his foot. And so if we're thinking about bacteria, so bacteria in the skin, those chronic staph infections, ozone is incredible for it. So again, just another example of just a very powerful treatment, right? So let's talk about chronic infections. So we see a lot of people that end up with chronic viral reactivation. So sometimes that's Epstein-Barr, often that's the one that's checked. So these are chronic monoviruses. That's also cytomegalovirus or CMV and HHV6 and 7. So those are herpes viruses that are mono, not herpes like oral and genital. So all of them they all live in your body for the rest of your life once you catch them, and they go into all your tissues, and basically they just can make people feel like crap, basically, run down. It's that feeling of like, I'm chronically tired, and then sometimes I feel like I'm getting sick, and then I rest a little bit, and then I don't get sick. What was that? Well, likely that was your mono. So there are ways to test for that. We can actually see, your long-term antibody levels and viral reactivation. So, and that's done through the normal Quest or Pac Lab or LabCorp. So they can be difficult to suppress and get down. Also thinking about something like Lyme. That one is more like a parasite, gets all throughout your tissues. Can be very difficult to eradicate. So that's when we start thinking about, when we really want to get some strong movement for the immune system and eradication and suppression of these things, that's when we introduce ozone. Now, we might be doing some other things too. We might be doing some herbal antivirals. We might be doing other things that, removing toxins so your immune system is functioning better. But I love adding, systemic ozone as a therapy to really help your body kind of get a leg up on these viruses or these chronic infections and keep them truly suppressed. So let's talk about a little bit about like what that looks like. So if we're doing systemic ozone, often we like to do it as an IV, the IV MAH. It's called major autohemotherapy. It's where we take your blood, add a little heparin, put it into a sterile saline IV bag, and it's reinfused. It's actually very, very safe. People tolerate it really, really well and typically feel really good after. Sometimes they do have some die-off reactions of the viruses or toxins or bacteria, but that passes and then it gets easier as we go along. And can help address, if you have other things too, like joint pain or autoimmunity, things like that will help you in that way as well. So we can also do systemic ozone through it's called rectal insufflation. And that probably sounds like weird or horrible. Essentially, it's just like a gas enema. So something you do yourself, something that is medically supervised. It's something we prescribe. We have to prescribe the oxygen, and goes through the colon, absorbs through the colon, and goes all throughout the body. So say if we're dealing with different gut infections, that's a really nice additional add-on. Although I'll say, like with my diverticulitis people, we did the IV ozone. We didn't do rectal, and we cleared the infection. So, but they can be used together, and there can be benefits for both. Sometimes rectal, something that you can initiate at home, which is really fantastic, and then you can do on a daily basis. The IV, we'd be looking at, depending on what you're dealing with, if it's something acute, we might only need, I would say, 1 to 3 treatments, something like that. If we're dealing with a chronic infection, we might be looking at somewhere between 5 to 10. So what are the things that we need to know about you before we start the therapy? We really need to see your iron levels, your stores of iron, ferritin, just to make sure that those are optimal. And then make sure also you have a normal G6PD. And we usually like to see like a normal liver kidney function and something called a CBC, looking at all your red cells, things like that. These are all it sounds complicated, they're very basic tests and just simple ones that we can build to insurance and that tend to be covered just fine. So, so if this resonates, if you have any questions, if you're like, oh my gosh, I actually have been diagnosed with chronic mono that I just feel like I can't get under control, or I do tend to get, diverticulitis, or I have another type of gut infection, I have SIBO, and I've had a really difficult time getting that under control, or overgrowth of some other bacteria that's been identified, like, let's consider this as an option for you. So if you have questions, would like to know more, please reach out to us. We'd love to chat with you, and thank you so much for joining me today. As always, appreciate it, and I look forward to seeing you next time.